I'm happy to introduce Dr. Lynn Marshall. Dr. Lynn Marshall is a family physician with a fellowship in environmental medicine. She works at the Education Liaison and Director of Enhanced Skills Program in Clinical Environmental Health, as well as a staff physician at the Ministry of Health and Long-Term Care funded at the Long-Term Care funded Environmental Health Clinic at Women's College Hospital. Dr. Marshall is an assistant professor at the University of Toronto's Department of Family and Community Medicine and Dalalana School of Public Health, and is also assistant professor in the clinical sciences, it's been a long day, as a assistant professor in the Clinical Sciences Division of the Northern Ontario School of Medicine. Thank you for coming, Dr. Marshall.
Thank you very much. Okay, people are coming in. Come on in. What has environment got to do with fibromyalgia? Lots of people ask me the question. What has it got to do with this? It doesn't look like it's apparent. Well, we will today talk about the changes in the environment since World War II and changes in human health, and maybe they're associated and maybe not. We'll talk about that. Examining the research challenges, there are many. And the multiple determinants model of health, which we use at the Environmental Health Clinic. The World Health Organization uses it, and it's increasing in the usage in medical practices. And then we will describe about exposures, how you learn about exposures that people would have encountered, and what to do about them to protect their health. So changes in our environment for 70 plus years since World War II. In North America, there are approximately 82,000 chemicals in commerce since World War II that were not in commerce before that. And in the United States, they have almost 2,000 in high production volume, greater than 1 million or more pounds per year. And they find that the detoxification information is not available for half of them. And the developmental toxicity is not available for more than 20% of them. In Canada actually was really lauded for their look out the 25,000 chemicals in Canada, and they placed on the domestic substances list that were in common use between 1984 and 86 when they started this study. But most of them have been unevaluated. So 23,000 wasn't doable. So they decided to focus on 4,000 commonly encountered chemicals that were persistent or bioaccumulative, accumulate in people and animals. And then they would evaluate them slowly under the Federal Chemicals Management Plan. And a few more substances are targeted for immediate review if they come up and meet those definitions, bioaccumulative, persistent, etc. And there's a reference if you want to look up the website. And apparently these slides are going to be posted. So in addition, the changes since World War II is that we've increased in worldwide travel, the industries have grown, and they've led to ozone layer depletion, and then the industries have emitted greenhouse gases which have a pressure on global warming, retain the heat, the greenhouse, retain the heat of the sun on the earth and contribute to global warming. The precipitation is variable, we all know that, and more intense, or droughts occur too. And also the glaciers and the snow cover is melting as well. Sea levels are rising, and there's advertisement that a lot of small islands will cease to exist because they will be flooded out. And we all know there have been more intense storms and hurricanes we've experienced too. Additional factors to consider that most of the Canadian population is urban. And the urban air is more polluted than the rural air. And we spend 90% of our time indoors. And the indoor air is generally more polluted than the outdoor air. So persistent organic pollutants are accumulating in the food chain, and humans, especially fetuses, babies in their mother's uteri, are at the top of the food chain. Drinking water is contaminated with multi things, and every human has numerous xenobiotics, as the CDC in the United States discovered. They did tests of blood for people and found everybody, even babies from the cord blood, had numerous xenobiotics. So we'll go to the World Health Organization definition of health before we go on to effects on health. So it has a broad definition. It doesn't just say if somebody has a disease or an infirmity, they're unhealthy. No, they say the health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or an infirmity. Some good things have happened since the World War II, and changes in health have been good. And so there have been the virtual elimination of infectious diseases, for instance, polio and smallpox, with the advent of vaccinations. Lovely. Reduction in childhood diarrhea with in water disinfection in communities. And the antibiotics have made a big difference in protecting people from life-threatening infections. In addition, we have in Canada rules about seat belts and bicycle helmets and child car seats, and that's prevented a lot of deaths as well. But the bad and the ugly is that in humans, multiple conditions have evolved, such as these listed. And in addition, cardiorespiratory morbidity and mortality, asthma and obesity and diabetes, these are all chronic, complex, multi-system conditions. Ooh, we know about that. And emergent conditions in humans, because since World War II, actually more recently than that, we'll talk about that in a minute, the sick building syndrome has occurred. Environmental sensitivities have been recognized and pointed out, and new increased infections that the usual antibiotics don't take care of have occurred. And increase in chronic, complex, multi-system conditions such as fibromyalgia. That's why I'm here, okay? What does the environment have to do with fibromyalgia? It is a chronic, complex, multi-system condition, and maybe we could make a dent in it by paying attention to the environment. So next we're going to Toxicology 101 and cover several topics in this list, and it's sort of interesting. I shouldn't prejudge. The dose response. Paracelsus, he lived in 1493 to 1541, long time ago. And he was a scientist, and he said the dose makes the poison. So he talked about the linear response from almost no exposure, a very low level exposure, so that you had no observed adverse effect level, NOEL, to increasing doses, and the persons that are exposed get sicker and sicker and sicker. Eventually they die. That's a linear dose response. And the problem is we are continually exposed to complex mixtures every day. We don't know how they are acting on us. And reproductive, endocrine disruptors seem to have a U-shaped, non-monotonic dose response, not a linear dose response. I'll show you what that means, but I want to tell you about these rats first. The rat on the left side, this left side, your left side, is a normal rat. The other one was fed endocrine disrupting chemicals, which were very common in the canned foods that we eat, and phthalates, the plastics softening. So they're very common. And that rat was, when it was in its mother's uterus, fed those. And it's very much more obese, much abnormal about that rat. So this is the paradigm shift in toxicology. So whereas everybody believed in the dose response level, linear, now they are starting, since the research has been done on endocrine disruptors, to understand that there are different responses. For instance, the U-shaped response, somebody has a reaction at a lower level, but the level increases if the reaction goes away. What? That does not make sense, okay? But that's the lower U, okay? Or they have a reaction, don't have a reaction, sorry. Don't have a reaction on the upper one at low dose, But as the dose increases, they have a reaction. But if it increases further, they get better. What? That's not really news. That's really abnormal, okay? But that's the way endocrine disruptors work. They work very, very tiny doses, and they disturb the hormones. And for instance, in the slide, it says the hormones signal the cells to develop a certain way, but the endocrine disruptors at very, very low doses interfere with that signaling. And development looks normal, but after the exposure is stopped and the person is seeming okay, but they have increased sensitivity to disease later on. And then we add in epigenetics, which is over top of the environmental exposures we directly get. Epigenetics is the ability to turn off and on the gene by environmental exposures. So sometimes the person will get a reaction because they've had an exposure that will turn on their genes so that they have a reaction. Next, we'll talk about pathways of exposure. And this is a sort of complicated diagram, but I kept it in because it explains that soil, dust, air, we inhale it, and that can give us trouble. Water, food, and breast milk we ingest, and that can give us trouble. And then consumer products we touch, and that can, again, give us problems. And in utero, children are exposed to their mother's chemistry, and after they're born, they already have her chemistry in their cord blood, and their mother, if she nurses the baby, which we hope she will because it's overall good for the baby, they have impact from that. And they contact the mother, touching the mother as well. So this is the fate of toxins if we, Toxicology 101. If we think of what happens to the toxins and if we breathe them in or eat them or touch them, this is what happens. They are absorbed, and then they're distributed around the body, and these are the main storage sites, and they next are biotransformed. So that we can eliminate them. They are able to be metabolized so that they are more water soluble, and we can eliminate them. And excrete then, as it says, through these various excretion. But for instance, it says that the perspiration is minor at room temperature. Absolutely true. But if the person goes in a sauna, that increases the temperature, increases the excretion of the chemicals. So individual susceptibility, everybody's individual. That's definitely true. But some people are more susceptible than others. Children are not little adults. Unfortunately, the regulatory governments of the world, actually, until recently, thought that children would be kept safe by having safety factors down from the adult dose. Thinking about the linear dose response model, okay? But it doesn't work like that, okay? And so children are really, really very much more vulnerable to environmental health risks because children have different or higher exposures. They breathe in, eat, and touch more than adults. They have dynamic developing physiology, and so they are not ready to metabolize and excrete all these compounds. They have key developmental windows. Sometimes they're not mature enough to handle these chemicals. Their body systems have not developed enough. And they're around longer. They have a longer shelf life, so they will accumulate more chemicals over their lifetime. When we think about it, we are what we eat, drink, breathe, touch, and can't eliminate. We retain some chemicals. So the total toxic burden or load is the total toxic exposure, and that takes into account the nature of the exposure, the dose of the exposure, and the timing if you have somebody who is vulnerable, and minus the ability to metabolize and excrete. And metabolic systems are the same in all cells, and they're very important for energy, as people with fibromyalgia know that they are responsible for the energy of adenosine triphosphate to perform life and breath necessary work functions. What is important, I think, to remember is that we are equipped with alternative pathways. Thank goodness, because otherwise we'll really be in trouble. But we're equipped with alternative pathways so to maintain the balance of stimulatory and withdrawal, and stimulatory exposures and withdrawal when you metabolize them or not come into view another mechanism. This is what it looks like, in my view. If the person is exhausted, they are not able to metabolize the chemicals that they are exposed to. So the Centers for the Disease Control said virtually all human diseases result from the interaction of genetic susceptibility. Yes, we all are susceptible to some things. Each person is an individual. And the modifiable environmental factors. Modifiable. Important to know. In other words, Stephen Januis, who is a very clever doctor out in Edmonton, and he writes a lot, and he says, in other words, genetics loads the gun, but the environment pulls the trigger, yeah. So what is the evidence for an environmentally related harm to increasingly common chronic multi-system complex conditions? It looks like this, the toxic iceberg. It's really, really difficult, and you'll see why, to sort out which is doing what. And so we maybe have proven harm to a little top of the iceberg, but partially proven little, but the iceberg is still largely unexplored. So evidence is hard won. Why? Risk assessment challenges in humans are many. Anybody knows that research funds are very, very hard to get. And so it's rare that enough research is done on a condition. Fibromyalgia is one of them. So the exposures are complex and from multiple varying exposures that may act together or may act in concert with one another, and so it's not good. And difficult to measure true exposures because you eat them, drink them, touch them, and breathe them. So how do you measure all of those? Not easy. So they provide ongoing exposure for the ones that we can't get rid of, the total body burden. If somebody is exposed along a continuum to something, they will have symptoms related to the bioaccumulation of that. For instance, mercury in fillings as one thing. Lead in paint, and we'll talk about that in a minute. The dose response can be linear or non-monotonic, and the problem is, and it's unauthorized to do, no problem, unauthorized to do controlled trials on humans because we don't want to introduce them to something toxic. And as I pointed out before, the uncertainty or safety factors for the kids have been extrapolated from tests on healthy adults. Adult males, animals, or humans, but they don't necessarily coincide with what the person is experiencing. Surveillance requires large numbers. Cost, again. The Ontario Health Study was interesting. It ran from 2009, 2017, and they had 225,000 participants over 18. So you can imagine how much that cost. But it turned up a lot of interesting data too. So this is another problem because everybody realizes that the higher on this evidence pyramid that you go, the less bias and the better power the study has. And so you start out with test tube or animal research, and maybe you go to case report, publish, good, and then maybe case series and case control studies, and set up a bunch of cases with a bunch of controls. I think that's probably what Dr. Cudahy has in mind. Cudahy, thank you, has in mind. And the cohort studies and the randomized controls trials, as explained. So what is the available evidence? Because we can't progress if we're not convinced that the environment is affecting us in health. Well, I don't want to go through each of these in depth, but there are strong evidence and moderate evidence. of birth defects related to environmental exposures. Reproductive difficulties, different responses in males and females. Neurodevelopmental disorders, again, there's associations between exposures and the neurodevelopmental difficulties. Cancer, there's associations between exposures to certain things and cancer, and different types of cancer. And cardiorespiratory difficulties is strong and moderate evidence again. And then there are the emergent conditions, sick building syndrome. So first noted in the 1970s because the Middle East oil crisis demanded that the government do something to save on fuel. And so they tightened the buildings and they lowered the ventilation rate. But they forgot to mention, or they forgot to think about all the new products that were indoors since World War II. So guess what? In the mid-1970s, 45, 50, chemicals are increasing, and they tighten the buildings. And in the 60s and the 70s, they notice sick building syndrome. And the World Health Organization defined as sick building syndrome in 1984. And there are multi-system symptoms as laid out there. Same as fibromyalgia, same as a lot of complex chronic conditions. And the National Institute of Occupational Safety and Health did investigations in problematic buildings. And they found that there were definite problems with ventilation and problems with contamination that affected the people. And then in 1965 and into the 1970s and the 1980s, an illness was described, which was environmental sensitivities or chemical sensitivities, now electromagnetic sensitivities too, and the definition is there from 1999, a consensus definition. And we did research at U of T, and we found that genetic polymorphisms were evident on these patients with these conditions versus controls where they didn't. It's a very common condition in adults, and unfortunately, we don't know what it is in children and adolescents because it's never been measured. Prevalence of CFS, FM, ESMCS, because we see a lot of these together, and we'll talk about that in a second, but they're very common. FM is 0.5 to 1.2%, and much more common in women, 3.4% in women versus 0.5% in men. And 80% of women still with peak prevalence of 6% and ages 55 to 60. So a person in middle-aged females as the peak. And MCS is common too. And then we look at, okay, how much are these costing the healthcare system? Yeah, a lot. And looking at the conditions together, average 21 visits to healthcare providers, and in the U.S., it's average 2.5 visits. So, yeah, well, that's true. That's true. But the work that has been done on this in Canada is the Canadian Community Health Survey, national. And it gives very important statistics of visiting doctors and the need for food security and social support, etc. So the overlap of these three conditions has been noted by numerous authors. And as we said, they all present with chronic, recurrent, multi-system symptoms. And the variety of symptoms is a challenge, because it's not just a straight, you have these symptoms, that's in. You have these symptoms, that's out. No, because people vary and they have some symptoms some of the time and not others of the time. So this is a picture of the overlap, and the people that in the center of the overlap, mostly that's whom we see at the environmental health clinic, because they're referred, because they're not doing well out in the community, and they hope that we can do something with them, okay? And it's really difficult for them.
Some people can ask questions.
Yes, sure.
Some people can work with fibromyalgia, but if you have chronic fatigue syndrome with the fibromyalgia, just forget it. 'Cause I've had
Exactly.
somebody with fibromyalgia. I work, and I said, not all of us can, because I have, unfortunately, got
Yeah,
CFS.
exactly.
So I probably have the multiple chemical on top of that, don't I?
Well, maybe, yeah.
Housing buildings closed a lot.
Yeah.
Sorry.
So genetic profiles in fibromyalgia the research has shown some differences, okay? From Spain, and particularly in COMT gene polymorphisms may predispose to that, and a serotonin receptor polymorphisms in fibromyalgia have been noted. And so the person has difficulty receiving the calming serotonin. And that's actually associated with obstructive sleep apnea as well. So this is the multiple determinants of health, the World Health Organization thinks is valid. And this is the diagram that appeared in the KIPCHI, Canadian Partnership for Children's Health and Environment, in a primer that we did in 2005. And many, many factors, as you see, that are determinants of health. Thinking of health in the broad term that the World Health Organization described. And the multiple determinants of health, if they're followed in the medical model, that looks at the whole person, not a little bit of the person, not one system, but the whole person, and there looks at all the factors that are involved in a person being ill, and then remembering socioeconomic differences, because around the world, if socioeconomic resources are poor, the people do not do well. they don't do well because they're linked with higher exposure and less nutrition, so less ability to metabolize. So the physician guides each patient to reduce or remove the exposures or the disease determinants and augment the health determinants, the nutrition and so on, so that they do better. This is a complicated diagram, but it just shows the multiple factors on the person, and they affect everybody's system. So fibromyalgia patients are not alone. My son, he drew this picture, another picture, and he said, "Oh, the patients are heart sink patients because they're complaining of everything." And I said, "I love your drawing. Can I use it when I talk? As long as you tell them I was only 14 when I did it." And so I do, I use it. So at our clinic, the environmental health clinic, we use a short form 36 test, as Dr. Kadahai said. She used a fibromyalgia impact questionnaire every time. We use it if it's appropriate for patients, but we use the short form 36 almost every time because it measures these 8 status domains. And we did research. We had a student from the university. Oh, wonderful. So the student went through all of our charts and accessed data on the 8 functional status domains that we said, okay? And so the top, the blue, is normal. And the red is CFS, the yellow is MCS, gets where fibromyalgia. All right, at the bottom. And if you have one or more, which is very common, yeah, it's even lower, okay? Yeah. So this is the other diagram. Dr. Fred, no good. I like the stethoscope in the wastebasket. But doctors get frustrated too because these complex chronic illnesses, it's difficult because they're confusing. There are no clear-cut patterns of symptoms, and a lot of potential contributors, and you have to take time to sort them out. And no help, of course. Oh, and there are no helpful laboratory tests. That's a frustration as well. And there's no quick fixes. And so it was exceptionally time and energy consuming to manage medically. I throw my stethoscope and wastebasket.
You're so sick when you're going through all these tests.
I know.
And then CPP gives you a hard time if you don't get 3 specialists instead of 2. When one specialist wouldn't even send it in, it's crazy. And you're so tired. You say, could you please take something?
Yeah, I know.
For all the doctors?
I know. It's really unjust.
It is.
So what do we do when we run out of specialists? But because the doctor refers here and here and here and here, hoping to get answers, but it's really not easy answer. So how to take an exposure history. I'm coming to this because I think it's a thing that we've really missed, and I think we need to be aware of it. So find out where the people are exposed. So chapter, CH2OBD2, if you're a Star Wars fan, stands for community, home and hobby, occupational, personal, diet, and drugs. So we have forms that go through each of these settings and ask questions about the person's exposure now and throughout their life. And when do we take an environmentally focused history? Well, I think if a person enters into your practice, that's a good time to do it. So you know right off the start what they have been exposed to in previous times. And what they are doing for preconception, how their mother was cared for preconceptually and conceptually, and whether they took vitamins, etc., whether they had well child visits, and then symptom onset that the patient links with specific exposures. But in addition, I really think it's important to do it if there's an onset of any puzzling illnesses. And not only that, but the different family members could go to the doctor for different complaints. But if they're visiting frequently, different family members, frequently, but different complaints, I would be thinking, what's up here? Okay, and I would take an exposure history to find out. And then if the person has fibromyalgia or another chronic complex multi-system condition, I think it's important to take it because you maybe find something that would help. So how do you interpret it? Watch for increased exposure, and singly or in combination, because we're not exposed to one thing at a time, we're exposed to a bunch of things at once. So asking about all these substances in the CH2OPD2 format, and then watch for increased exposure, singly or in combination. And then we, at the environmental clinic, we use a light-hearted approach, the weed, seed, and feed approach, whereas we suggest to the person they weed out known aggravators. People are often very good at identifying what is aggravating their symptoms. Okay? Help them to weed out. And then plant seeds of health. And seeds is another acronym. Sleep, exercise, environment, diet, and support. We've heard about that earlier today. And then feed the seeds. Whatever works, feed it. So we will think about where as a person is exposed. What are they breathing in? So you reduce the contaminants at source, or you switch to less toxic substances. Use green cleaning products, which is, it says there, and less toxic personal and laundry products, and least toxic pest management approaches. A lot of people, immigrants, it comes to mind, have been really made ill by using pesticides indoors because they have a supply of bed bugs or something. Okay. No scent makes sense. And we use a poster here. Our hospital is fragrance-free, and the environmental health clinic is fragrance-free. So, Women's College, yeah. If, you know, last week I was giving another talk, and I showed a picture of my mentor, and he was giving a talk in the 1970s, and he was, it's the blackboard here, and he's talking and it says on the sign, handwritten, "Thank you for not smoking," exclamation mark. That would never be seen now because nobody smokes indoors, right? Thank God, right. So the next thing that would be easy to get rid of are fragrances.
They're doing that though, I've seen them in the offices.
Yeah. But, yeah, it's still a fight. It's still a fight. Okay, another principles are decreasing indoor air contaminants, dilution, and filtration. These are tried and true methods. And a general message to decrease body burden. Decrease input by changing the substances that you use, and take an exposure history to see what person could alter, and increase output, increase the person's intake of vegetables and fruits, and that will help them detoxify. Hydration, exercise will help too. And then optimize bowel and kidney function too, yes.
What do you do in a senior's home? My ex-husband's in a senior's home and he's getting sick because it's not done right in there at all.
I know.
So how can I
The-
help him? Is there anything I can get him to help out?
No, well, ventilation, you have a filter, air filter. Yeah, yeah. And so, eat less contaminated food, easy to, organic when possible, but often, you know, people can't afford that. I know, but there are certain times of year you can afford certain things because they're local, okay? So, that's, store in glass, not plastic. Oh, plastic, phthalates, okay, comes out into the food. And drink less contaminated water. So hopefully it's clean at the source. Toronto water is good. Or filter it if you necessary, and promote the other health methods. And we hope that you will return to adaptation. This is even teeter-totter. And notice we have sleep, exercise, environment, support, and diet. Diet and support. Seeds of health on the other end of the teeter-totter. So this is a summary from Dr. Stephen Januis from Edmonton, and he gave this at a talk, and I thought it was very succinct and very useful. So the genome we're born with. We cannot do anything about that, okay? But we do know that the environment, we can do something about it. As the Center for Disease Control, it's modifiable environmental exposures. So avoid the toxicants and make sure you have sufficient vitamins and minerals and good food detoxified. Sorry.
Vitamins detoxify? I didn't know.
Well, in your food. Okay. Yeah. Some people take vitamins as well if they are low, if genetically they are low on some vitamins, but you need to have blood tests and so on. So this is a take-home point. Even relatively minor exposure reduction may bring about lifelong health rewards. So you take an exposure history on yourself. Community, home and hobby, occupation, person, diet, or drug. And see if you can reduce exposures there and increase your nutrition. And that's it. Any questions? Yes?
For the Ontario Task Force, they called fibromyalgia an environmentally linked disease. But really, any disease is environmentally linked. So why isolate those ones in particular?
I don't know. I don't know. But anyone is, right. Yeah. Yeah, okay. Yes?
You heard that fat, I know that fat stores toxins, right?
Fat, yes.
So you have in your body. Then you also have fake cell sculpting, where they kill the fat cells, so then there's, over 2-3 months, you have the release, not that I've had it, but some people are getting it.
Right.
But I'm concerned about the toxins involved, so there's immediate release of toxins because these fat cells over a month are being destroyed.
Yeah, I really don't know about that. But that's why I think the reason why women and middle-aged women are more susceptible. We have a higher fat supply than men, same age, and we retain the toxins in the fat.
Toxins are being released to the rest of your body to absorb elsewhere.
Yep, yep, yep.
And another part of the question is, our brother's apartment has mold. I'm trying to get the fan, tell the landlord to replace the fan. So the whole thing is, I was reading on that, and it says that mold is linked to Alzheimer's. And this makes sense, because you're saying that the toxins are stored in the brain. So you get the toxins stored in your brain, obviously it's going to do something.
Well, it's stored in the brain, but it's stored in many other places too. Yeah.
Is that a link to toxins in the brain being Alzheimer's?
That's one factor, but that's not the only factor. Yeah. But mold is a really big problem. And at the clinic, if we have people that we have considerable mold, we ask a building biologist to go in and look and see what he or she would suggest to rid the mold. Yeah, it's really big. Yes?
Is there any wisdom in the old adage of building resistance via exposure to different kinds of things?
Yes and no. Okay, that's a complicated thing. For instance, it was noted that children who were exposed to allergens early on, that would be resistant. Yes, but if you're exposed too much, that's the amount, is the timing, the dose, the amount, and the mixing. It's not a clear answer. Yeah.
Okay, thank you very much for coming, taking the
You're
time.
welcome.
And a little token of our appreciation.
Thank you.